Doctors, nurses, and other hospital staff right across Canada have put so much on the line by facing this pandemic head-on, and their critical work is paying off. We're now beginning to see plans for provinces to resume elective surgeries, cancelled to prepare for COVID-19. But the backlog is huge, and as Heather Yourex-West reports, it's likely to be a long road ahead.
Jerry Weisenfeld has waited 4 years for knee replacement surgery, but days before he was scheduled to go under the knife, he learned his procedure had been cancelled.
I guess they have to take care of people who are in far worse shape than I am.
The COVID-19 pandemic meant thousands of elective surgeries had to be put on hold. BC officials counted 30,000 missed procedures in that province alone. With COVID-19 infections now waning, BC's chief medical health officer says the time is right to get BC surgeons operating again.
We can now safely assume that most patients do not have COVID-19, and that allows us to change the protocols and to make them no less safe, but certainly a little more streamlined.
Elective surgeries have restarted or will soon resume in many other provinces across the country as well. But getting through the backlog won't be easy.
Even to get back to the normal capacity in normal times, we're not able to do that yet because we still have staff who are involved in caring for COVID patients. They might be redeployed to long-term care. And we also have these supply chain problems for personal protective equipment, for drugs. There's a lot of moving parts.
Some patients may not be able to safely wait much longer. Over the last 2 months, urgent cancer surgeries have continued. The concern now is that those other cases may have progressed.
The patients who may not have appeared very urgent, who in normal times would have a wait time of about 3 weeks or 4 weeks to have their cancer out, are now into the 6 weeks, 8 weeks wait time, and that's where we lose predictability of the disease.
And so there is little time to waste. Ramp up surgery again or risk having this pandemic claim even more lives. Heather Yourex-West, Global News, Calgary.
One of the largest poultry plants in Canada is dealing with an outbreak of COVID-19. Tonight, an employee at Maple Lodge Farms is speaking out about the conditions inside the facility. At least 25 workers at the Brampton, Ontario plant have tested positive for COVID-19. One person has died. Global News spoke with an employee today, and we have agreed not to reveal this person's identity for fear of reprisal. The worker says Maple Lodge Farms is not providing enough PPE to keep staff safe.
It's scary, very much, because it can happen to anyone now in the workplace. They keep the plant open because they want to keep Canadians like food and stuff, but at the same time, the workers are just as important, if not more, because we're the ones who are processing the food for Canadians.
Global News reached out to Maple Lodge Farms for a response. In a statement, the company says Public Health and the Ministry of Labour are the authorities of public and workplace health, and both are satisfied with our preventative plan and the measures we have implemented to keep our employees safe.
The new series that goes inside the COVID-19 pandemic, from the front lines to the everyday heroes helping us cope with the unprecedented change. Coronavirus, the new reality. A Global News special, Sundays at 7 on Global.